Hey guys, welcome back to my channel. My name is Lavette Cheesy, and this is another episode of Mental Health Talk. Today I am talking about depression because it is a topic that I feel really needs to be addressed. Like, we need to talk about it more often than we actually do. We've all experienced some kind of depressed symptoms one way or the other. Either we actually knew we were experiencing symptoms of depression or we don't. Like, personally, I have. So if your life has been perfect and you haven't had any case, like you have never felt lonely before, you've never felt like empty, or you've never felt sad for no reason, then I guess you're lucky. But I want to talk about this because I find it really sad that it's okay for us to talk about our physical health, but it's almost not okay to actually express how you feel mentally. So why is it okay for me to say my stomach really hurts, and you tell me, oh, you know what, you need to go to the hospital, or you bring me soup, or you try to make sure I'm okay, you nurture me back to health. But why is it not okay for me, or why is it so difficult that when I come to you, or somebody comes to you and say, I feel empty, I feel so lonely, and you don't transfer the same empathetic behavior, you don't transfer the same care? We really need to talk about this because depression is so serious, and it's one of the leading causes of why people commit suicide. Research has shown that currently suicide is one of the leading causes of death. So I want us to sit down together to try to understand what depression is and try to understand how we can help people. For us to fully understand what depression is, let's break it down. Let's understand, what is it? What exactly is depression? Or how do you know you're clinically depressed? First of all, you need to understand that there are different kinds of depression. Example, there is major depression, atypical depression, we have postpartum depression, we have bipolar disorder, there is also psychotic disorder, and we have situational disorder, which I'll explain to you guys in a minute exactly what situational depression is. To fully understand what it means to be clinically depressed, according to the DSM-5, which is the manual used to diagnose people with mental disorder, there are different symptoms of depression that is listed. And according to it, it says that if you are experiencing 5 of those symptoms for more than 2 weeks, for 2 weeks or more, then you're considered to be clinically depressed. So what are some of the symptoms of being depressed? Are you feeling lonely? Are you feeling empty, like you have nothing to live for? Are you feeling just so sad? Are you always tired? And I'm not saying tired from where you work too much and you're tired. No, like just tired from doing nothing, like for no reason, you're just tired. Are you irritated, getting easily irritated, easily angry, losing your temper? Are you eating too much, which we often call stress eating, or not eating enough? Are you oversleeping or barely getting any sleep? Are you just feeling worthless, feeling like you have no reason to live? Those are some symptoms of depression. So let's talk about situational depression. This is not a technical term used in psychology or in psychiatry, but situational depression is a result of having depressed mood when you are having trouble managing stressful situation in your life. So for example, you've lost a family member, or you're in a bad relationship, struggling with a breakup, or job issue, job security, steady income, financial issues. You just feel like you're not where you want to be in life, and you just feel like you're lacking something, and you just feel like you need more. Those are situational depression. So you're feeling all this, you're having all these moods based on that situation. Why don't a lot of people talk about their problems? Because we feel like people won't understand. We have the fear, we as humans have that fear of being judged. We have that fear of being seen as weak. We don't want to be seen as weak, especially in our Black community. Our Black men, our African men, like, they are so fixated that they put up this strong personality. They want to act like they're perfect. They don't want to act like everything is okay. They want to be great, so they don't talk to people. And I don't blame them. Like, we put so much expectation on men. We expect them to be strong and masculine and not to show any emotions. And we asking for this and we're demanding for that. And we totally forget that we are putting their mental health at risk. So they want to live up to that expectation. So our men, a lot of Black men, are going through this, and that's why you see there's a higher tendency for men to commit suicide than women. Like, as men or as individuals, we shouldn't always try to be so great. We need to remember that as great as we are as well very flawed. A lot of people going through depression feel like they're in a bubble. They feel like nobody can see them. They feel like they are drowning, like they are screaming, help me, but nobody can see them and nobody notice. And sometimes what people need is just that little care. You would be so surprised what that little act of gesture would do. That just texting somebody, calling the person and say, how are you doing? Like, really, how are you doing mentally? Some people just want to talk. Some people don't have people to talk to. Some people live in a country where they're far, far away from family, no friends. It's hard. When you're depressed, you lose the zeal of doing anything. You stop doing all of those things that set your soul on fire. You feel so weak that you cannot do anything. You have no motivation to do anything. So when somebody is depressed, being depressed should be treated just the way you treat someone that is sick physically. If somebody gets in an accident or something and they have like a broken bone, you give them days and weeks and months to recover, correct? You don't just go and pull them out the bed and say, oh, get up, now you can walk, like walk. It should be the same thing. When you're depressed, it could be so hard to get out of bed. You just want to stay, you might just want to be in bed all day. So do you just go and like yank up the blanket and say, get up, like, let's walk, like, oh, don't be lazy. Like, it shouldn't be treated that way. It should be treated with care and sensitivity. You should be willing to listen. And are you just gonna say, oh, I don't even want to call her anymore because she'd just be so angry all the time and so irritated. That's because those are the signs and symptoms of depression. She's so angry all the time and so irritated all the time. But was she like that before? And you know that's not the kind of person she is. Shouldn't that tell you, like, yo, like, there's really something wrong? Mental health issues is very important. It's as important as physical health. If I have a migraine and I'm able to tell you I have a migraine, I want to be able to tell you when I feel down and I feel lonely without you looking at me as weak or judging me. You as a friend or as a family member, what's your responsibility? How do you play a role in people's life? We need to learn to be positive in everything. We need to be able to take that negative thought out of us and be willing to and learn to listen. Listening is a skill. Everybody should learn to listen. Do you listen to your kids? Do you listen to your friends? Do you listen to your family members? Do you call them and say, hey, how are you doing? And actually listen, and not just the regular, oh, how are you doing? Because that's how we try to start conversation, but actually being interested to want to know, how is that person really doing? And then how do we react when somebody comes to us? Or how do we address the issue? Do we get judgmental? Or do we start giving them pep talk like, oh, be a man, get over it, don't be lazy, shake it off, it's not a big deal? Do you tell somebody to shake off a fever when they have a fever or a broken leg? Oh, shake it off, you'll be fine? So why don't we treat mental health with the same empathetic behavior? How about, hey, I can't really tell you I know what you're going through, but I want you to know that I hear you and that I'm here for you and I'm always willing to listen to you, and I'm willing to help you in whichever way I can. Do you follow up with somebody that comes to you and say, look, this is what I've been feeling? Do you follow up to say, hey, how are you doing? Are you feeling better? So you don't do that, and then when something bad happens to that person, you go, I should have done something. I should have listened. Why didn't I see it? You didn't see it because you never asked. You didn't see it because you're too caught up in your own life. To sum it all up, I'm just saying that we all have issues, we all have problems, we all have things going on in our life, but we need to remember that everybody has problems too. And you can actually be there for somebody without necessarily being in their problems, because some people are not comfortable enough to come share the problem, to tell you exactly what's making them feel the way they're feeling, because they feel like you wouldn't understand, or because they feel like people are going to be like, oh, it's just money issue. You know what? It's not a big deal. You don't necessarily have to ask the person exactly or try to get in the person's business, but you can make the person see that you care, you're there to listen, and that they're seen and heard. Depression is a serious issue, and we shouldn't take it lightly. We shouldn't take any mental issue lightly. The way we treat physical health, we should treat mental health issues like that. Let's show empathy. Let's show love. Let's learn to listen, because listening is a real skill, and people start to heal when they feel heard. Yes, we look at our dads and our uncle and our husbands, boyfriends. We look at them like superheroes, but we need to also remember that they are humans and they're very much flawed. They have emotions, and their mental health can be at risk. So let's ask them how they are doing. How can we help each other? So let's try to not dismiss people. Learn to listen. Be there the way you can be. Don't be dismissive. You can just sit down there and not say anything, but just let the person know that you're there. And on the other hand, if you're someone going through something, because I have gone through something, I still have stuff going on in my life too. We all do. But let's try and learn how to communicate our feelings. Find somebody that you can talk to. And if you cannot, consider therapy. Seek professional help. If you're someone going through severe chronic depression, where you're just sad and you're just in this funk, like you don't know why you're in that mood, it can be hard. I want you all to know, if you're going through this, or you have a family member going through a hard time, I want you guys to remember that there's somebody out there that loves you. There's somebody out there that sees you, even if you don't notice it or you feel like nobody can see you. Let's try to make mental health issues normal. Let's have talks like this on the table while we're eating breakfast. We all need to remember that we're all in this together, and that at the end of the day, we're all just struggling to get through this thing called life. We all have something else to offer, and we can help each other one way or the other. I hope this video was helpful, and I hope it was encouraging to somebody out there going through something. Again, don't forget to like, subscribe, and share for more weekly videos. Join the family, be a part of the family, and welcome to the family. Until then, I'll see you guys in my next video. Bye-bye.